So I'm here with Dr Alp Notghi, who is President of the British Nuclear Medicine Society. Dr Notghi, why did you choose nuclear medicine?
I was actually initially not doing nuclear medicine. I was in renal medicine, and as part of the research, I was involved a lot with nuclear medicine. And then I realized that it's a very nice combination. It brings a lot of science, including physics and physiology, with clinical medicine, which is, for me, is an ideal combination. I liked it. So it gives you the opportunity to think about things as well as treat patients. You need a lot of interest in physiology, and gradually in anatomy as well. It comes into it because physiology and anatomy are quite linked. So this combination of being able to do clinical work and scientific work was a big attraction for me. And gradually, once I moved into it, I realized there's a lot of therapies in it, there's a lot of patient contact, as well as, if you wish, a lot of research. So that was very attractive for me.
And what would you say is the biggest challenge facing nuclear medicine as a specialty at the moment?
It's the change, really. There's a lot of change in nuclear medicine. It started as sort of imaging, it's a physiological imaging, and it's evolved now to a very complicated molecular imaging system. It has incorporated other imaging like CTs and MRIs as part of it. The way we image, the cameras and everything has completely changed. They are evolved and made it much better and more interesting. And also there's a big expansion in the therapy. So the challenge is really to get them all together, be able to, training-wise, to deliver it within rather long training, which is 6 years. However, it's a lot to learn. And its the main challenge is to keep its niche and development going on in competition with other new imaging modalities which are coming as well.
What would you say is the most exciting development in nuclear medicine?
In the past, it's been technology quite a lot. We had a new way of imaging with PET, which is positron emission tomography, which has now established itself. There are new advances again in technology of imaging, which brings solid-state cameras, which is exciting. There has been a lot of advances in radiopharmaceutical, both for imaging, which looks at physiological processes rather than anatomical structures, and also in therapies. There is a lot of exciting new therapy comes, which actually making nuclear medicine more of a patient treatment as well as imaging as well, which is very exciting.
What do you think nuclear medicine will look like in 10 years' time?
Very different, I think. We will have a combination of more imaging modalities. At the moment, there is as a standard now. Nuclear medicine cameras and CTs are combined, for example. I think MRI, CT, maybe ultrasound will all be part of the same system. So you'll be doing multimodality imaging, which gives you a lot of extra information on structure, physiology, and how things are working, basically. We will have a lot more therapy, I think, very specific therapies. It may be mostly cancer at the moment, but I'm sure it'll be other modalities as well. We'll have, just recently there's development, for example, in imaging amyloid, which is Alzheimer's, a big problem. And there are quite a few new PET as well as SPECT imaging radiopharmaceutical coming into market. So we'll be looking at new diseases, we'll be treating new patients, and everything will change. What I hope remains is this association between, it's a very multidisciplinary specialty. We've got, in your department, you've got physicists, you've got technologists, radiographers, radiologists, and nurses. So it's a very multimodality, and I hope it will retain its multimodality as well. Multidisciplinary as well.
What advice would you give to an ST3 who's just starting their specialty training in nuclear medicine?
Yeah, the training is brand new. This is the first take this year of the new training program. So it's different. During this training, the ST3 will first do the radiology, and in 3 years he will do a lot of radiology and actually becomes a competent radiologist with FRCR. And then at the same time they will be doing some nuclear medicine, and then they will change over and do a lot of nuclear medicine and still do a bit of a radiology to retain their expertise. And during that they're encouraged to do MSc as well. So it's a lot of work to do, but the good thing is that you've got a lot of things to see, decide what you like best, and the main thing is that enjoy while you're doing it, because if you enjoy it, you will be a trainee for life, even after you're a consultant. So just enjoy it, and gradually you'll develop your own interest, and once you become a consultant, you'll expand on that.